Good afternoon. Welcome to today's webinar on the Affordable Care Act. My name is Matthew Derries. I'm the Professional Development Coordinator here at ASBO, and I'll be moderating today's call. This webinar is a continuation of a webinar of the same name that we held about 2 weeks ago, which had almost 200 people attend. In that webinar, we had so many questions that we couldn't get through the actual slides. So this time around, what we're going to do is we're going to ask to either hold all your questions until the end, or you can type your questions into the question and answer panel on your GoToWebinar system, and we'll address those at the end of the content. So if you please go ahead and do that, ask your questions at any time in there. We'll just queue them up and we'll get them answered at the end. And if for any reason we are unable to get to your question, I will be aggregating all of the questions and sending them to Mike and Kirsten at the end, and will email me back all the answers, and I'll get them out to everybody as soon as I possibly can. So with that out of the way, I'm going to turn it over to Mike and Kirsten, and we'll...
Great.
Sorry, I muted myself there by accident. Sorry, Mike and Kirsten, it's your show.
All right, thank you. Welcome, everybody. Last week we talked about this, and policies and procedures. One of the things that you as a district have to do is you have to have a written policy for your standard measurement period, your admin, and your stability period. Also, the question we posed are you handing out the notice of exchange to all new hires? Is your district providing the SBCs annually?
Your SPC is the summary benefits of coverage, and that's important. That's $1,000 a day penalty, so you want to make sure that you're getting out that. That has to go to all current employees, the plan that they're on, and then all new hires, any plan that they have an option for. As Mike said, you want to make sure you have a written policy for your tracking your policy period, which would be your measurement period, your admin, and your stability. We'll get into those a little more. And then are you following all of the policies and procedures that you have in place?
And then the other important thing is as we've been working with finance manager with some of our clients, we've noticed that hours aren't assigned to coaches or stipend employees. Typically in the system you have built a unit, and it's typically one, and then you see the payment for the stipend. Hours should be tied to that, so we'll talk about that again when we get into the measurement period, but best practice would be to have a job description for all your coaches and assign hours for that duration of that period of time that they're going to be coaching that given sport.
So anyone that's over 30 full-time equivalents, which we're going to assume for this call that all of your districts are over 30 full-time equivalents, you need to track all of your variable hour employees. So the Affordable Care Act says that anyone who works an average of over 30 hours, you have to offer them minimum value affordable coverage or there's a penalty. So to figure out your full-time people, you know that when you hire somebody and they're a teacher or they're in a position that's eligible for benefits, they get their benefits within 90 days of hire. Anyone who is a substitute, is a variable hour employee, maybe a coach, maybe you have some grounds people or security or bus drivers, all of those people you need to track their hours to see if they average over 30 hours per week over your measurement period. Now the law says that you can choose a measurement period from between 3 and 12 months. You're going to choose a 12-month is what we would recommend, which is a longer time. But as a school district, on their 10-month employees, you can only use 10 months for tracking, even if you choose 12. So any 4 consecutive months that there are weeks that they're off, you cannot use against them. So that's something you want to make sure that you look at when you're doing your tracking.
And your look-back period for school districts that had a 7-1 renewal, a standard 12-month look-back period would have been 6/1 of 14 to 5/30 of 15, and then a 30-day admin period, and then you'd roll into your 7/1 renewal, and you'd offer coverage to those people, and then you could then have them in their stability period for the next 12 months, should they become eligible, and they average the 30 hours.
And remember, you need this policy in writing. Everything you're preparing for is to get ready for an Affordable Care Act audit. So when you get audited, it'll be similar to a DOL audit, where they'll send you a list of everything that they're going to look at, check, and then when they get there, they'll check, are your policies in place and how are you following your policies. Make sure you have everything documented.
IRS reporting. This is probably everyone's concern as we're on this webinar today. We basically have T-minus 30 days now for most freestanding tools that will do the employer reporting. So our recommendation would be to find a tool. If your vendor is going to do it, make sure you populate the fields in order to do that.
And what he means by that is your payroll company. So if your payroll, you think that finance manager, or maybe you're using WinCap or somebody else, they're going to need all the information populated on your employees, your start dates, on your COBRA. If you're self-funded, that would include all of your dependents, and we'll get into that a little more. So who's responsible for the 1094s and the 1095s? The 1094 is a transmittal to the IRS that includes all your 1095 information, and your 1095 is what you're going to give to all of your employees if you're fully funded, or if you're self-funded, you're going to give it to all your participants on your plan. So number one, that's one thing that you have to know before you even start the process, if you're fully funded or self-funded. And if you're with NYSHIP, you're self-funded. NYSHIP is a self-funded plan, so no matter what size group you are, NYSHIP's self-funded.
In April 9th, NYSHIP sent out a circular that stated that they were not going to do the employer reporting for their groups, but they were going to provide a reconciliation file that shows all the membership on who had coverage when during the course of the year. So I would be looking for that on the reporting in your billing system with NYSHIP, and you'll be able to grab that documentation that you're going to need for the 1095s that are going to be issued.
And if you're with another carrier, you're going to want that information on who was covered on the plan, and you need that by month. Because again, you're reporting, and we'll get into what the forms look like, but you're reporting on a monthly basis who was covered under your plan. The 1094 is the transmittal, as I said. This is due to the IRS February 28th or March 31st if you're filing electronically. Most people here would be filing the 1094 electronically, so you're going to have till March 31st. Your 1095C, again, that's the one that goes to the employee, and you have to provide that on the same timeline as your W-2s. So it would be sent out, make sure the employees are getting it by January 31st.
Now, there has been one recent update as far as a 30-day extension. If you write a letter to the IRS, you can get an extension for the 1094Cs, but you will not be able to get an extension for the 1095Cs, which are due out January 31st.
So far. And they did raise the penalties on that. We'll go over that. So what do you have to report? If you're fully insured, you're going to report on your employees only. And you're going to cover who was on your plan as an employee, the affordability, and the minimum essential coverage. So if you're self-funded, you report on all participants in the plan. That means all of your COBRA people, all of your retirees that are under age 65, all of your dependents on each plan, every belly button who has coverage under your plan that's under the age of 65.
Yes, self-funding, the requirements are a lot greater, so knowing exactly what you are is going to dictate how much work you have to put into this project to be ready for January 31st.
If you're fully funded, then your carrier will send your employee a statement on their dependents. So they're actually going to have 2 when they go do their taxes. And the reason for these forms are to show who has credible coverage and who doesn't have credible coverage. So when you go did your taxes this year, and the question just asked, have you had coverage in the last 12 months? You check the box, yes, everybody did, and then the federal government or the states gave out subsidies for anyone without checking. These forms are going to verify exactly who had coverage and that it was affordable, and it should stop on the back end some subsidies that shouldn't have gone out this year.
And one of the other things that you also have to think about from a reporting perspective, both on a self-funded and a fully insured, is offers of coverage. So if you are a fully insured plan, the carrier is going to give you who was enrolled and when, but they don't know who waived and potentially took out a buyout from you. So you're going to have to report on a 1094 and 1095 submission to the federal government of those people that opted out of your program as well. They won't have any boxes checked in their 1095, but this is a function of basically stopping people who are taking a buyout from you and then trying to go and get a subsidy on the exchange. So they're basically double dipping. So this allows you to avoid a penalty by giving that 1095 showing that they were offered minimum value, affordable coverage, but they opted out, and therefore they won't be able to get a subsidy through the exchange.
And when you're looking at this slide, you're seeing everything that you have to put on these forms. So this is the kind of information that you want to make sure that whoever's doing this for you, they have all this information. Some payroll companies are doing it if you fill out all the HR information that's in there. So we use a freestanding tool. There's freestanding tools. There's different ways you can get this done. You can certainly do it by hand if you have the time and the capability. So you're going to fill out the top parts and put your employer's information, then your employee's information. And remember that these 1094s and 1095s are calendar year. So your tracking that we talked about earlier to see who's eligible for coverage, that doesn't have to be calendar year. But these have to match the W-2s on the calendar year. So you're going to check whether you offer minimum essential coverage. Do you offer it to the employees and their dependents? Because the law says that you have to offer coverage to the employee and their dependents under the age of 26, but you don't have to offer coverage to the spouses. The month's minimum essential coverage was available. You're going to check those by box of month. Each full-time employee cost for the single coverage. So you have to make sure that it's affordable based on the single coverage.
And one of the things to be thinking about here, and we'll get into it again when we look at the form, but I know in some instances with the school districts that we've are dealing with, they've had a change in contract during the middle of the year. So therefore, when you're completing the 1095s, there may be a different contribution number that's going to go in that box. And she just moved to the screen now. So in part 2 of that employee offer of coverage, you're going to put what the lowest cost of a single coverage is. And in some union situations, you may have a sunset where somebody was hired after this given date, and they may have a different contribution in there for single contracts. That's the number that you'd fill in there in each one of those boxes. And if there was a change during the course of the year, you may see a change again. So for those of you who have seen us present before, one of the things that you need to think about when you're negotiating contracts with your unions is best practice going forward would be to probably try and negotiate a higher contribution on family contracts as opposed to the single, because again, with this law, you're being judged on the affordability of your employee, not their families.
And when you look at the form, this is the 1095C, again, like Mike said, you're going to put in the contribution amount for the minimum single for each month. So if you do have a contract change or a contribution change in the middle of the year, that number could change not only for your groups, but for your own individual coverage. It could be a different number. So you need to fill that in by month. And then in the bottom, section 3, that's where if you're self-funded, you're going to put down every covered individual on the plan. So if you have an employee who has a spouse for January, February, and then they have a baby in May, and then
another spouse in June, they could show up on this as well. So think of those things. You know, not every box is just going to be checked January through December. So you got to make sure that you're staying on top of your membership and when they came on the plan.
You also have to look at, it does ask for their Social Security number. Now for dependents, you can, if you ask for the Social Security number 2 times, and you have to document that you asked for it, and there's certain time you have to wait in between. If the employee refuses to give it to you after you follow the law's rules, then you can put in the date of birth instead of the Social Security number. And if you look at the top, you'll see that there's a void and corrected box. So you want to make sure that whoever you're using or you in-house has the ability to void and do a corrected. You're going to use this if somebody goes out in December and they get married or they have a baby and you issue your 1095s, they come back sometime in January after you've already issued it and say, oh, by the way, I got married in December or November and I forgot to tell you, I want my spouse on the plan. So then you would have to void and do a corrected one and add the spouse at the bottom, and then you would just check the December box.
And just remember that all these 1095s are going to feed into your 1094 submission. So that's why they allowed the change or the time span in between from January 31st for these 1095s to come out. They know undoubtedly there's going to be changes that need to be made, and then you do the electronic submission at the end of March. And by that time, everything should be correct.
And the 1095 is for all large group over 50 full-time equivalents. If you happen to be a small district, then the 1094B is what you'll fill out if you're self-funded. So if you're a small district and you're self-funded, we see this a lot with NISHIP. If you have a small private school or something and you're self-funded with NISHIP, then you're going to fill out this. You'll see that it doesn't have the affordability section, because if you're under 50 full-time equivalents, it doesn't have to be self-funded. It doesn't have to be affordable.
And I wanted to go back to this 1095C form again. We've talked to a few districts, and they say, so all I have to do again in that box for the employee offer of coverage is put the same number that I put on my W-2. And again, the W-2 is really used, if you're over 250, you've had to put what the employee contributes and what the district contributes for them. And what they're using for that is really doing a calculation and a trend factor to see how many groups will be at Cadillac tax level come 2018. This form is reporting again on making it affordable for your employees. So it is not the same numbers that you put on your W-2s. It's the number of the minimum value single coverage for each person per unit that you'd put in that box.
And if you're self-insured, remember, it's all participants on your plan. So if you have any board members, directors, anybody who isn't really an employee but they're on your plan, they will also be getting a 1095 from you.
Again, with this form, we're really just trying to, if anybody's looked at the box, you have a whole bunch of codes that you're going to have to check. The system that we use, we take some file feeds and it will fill in the appropriate boxes and produce the report. The key here is knowing the form if you're going to try to do this by yourself. If you're going to use Finance Manager does have the system in place, but you do have to fill in all the HR buckets in their system in order to be able to do the reporting.
Right, with all your dependents and all your COBRA, and specifically your early retirees. So you have to make sure that by early we mean under age 65. If you have retirees that over 65, Medicare is going to fill out the forms for them.
Yeah, and that's been the biggest challenge when we've gone out and talked with everybody. Your payroll system reports on everybody who is active and in your system, but once they fall off and they're an early retiree, sometimes you lose track of where they are. A good solution there is when they're on your benefits, you can get some information from the membership data on their health plan to find out their name, their address, where they are if you've lost track of that. So again, early retirees in a self-funded world, you're going to have to figure out a way to load them into those systems in order to be able to generate your 1095s.
The penalties for non-compliance. So we want to make sure that we're looking at this. Plan design, typically your third-party administrator, NISHIP, will take care of this. If you are truly self-funded, you want to make sure that you have a meeting with your TPA and make sure that those are all in place. And that means the things like you have to have ER coverage, you have to have certain levels of accountability to make sure that it's a minimum essential plan.
The good news about living in New York State is that when we all think back to when this law came out, they defined minimum essential value or benefits, and basically they were hospitalization, they were inpatient testing, they were maternity, they were outpatient services, prescription drugs, mental health and substance abuse, things that we all had embedded in our core of our plan in New York State. We have about 40 mandates in New York State. So meeting minimum essential coverage, I don't think anybody on this call will have a problem meeting that. But it is always good to just have that documentation. There's a quick calculator out on the HHS website. Well, actually, when you go look for it on the HHS website, it'll divert you to the CMS website, which is the Medicare website. But there's only about 10 fields that you have to complete, and it'll give you what percentage of minimum value your plan is. And most plans, I can tell you, NISHIP plan as of last year was an 86%. So there hasn't been anybody that we haven't seen that is well over that 60% threshold.
Failure to provide your SBCs, that's your summary benefits of coverage. As I said before, that's a $1,000 fine per employee. So you want to make sure that you're doing that and you have proof that you're doing that.
Then what was just changed, and we talked about this again the last time, it was hidden in the trade bill. Initially, when we were doing our presentations in June at the conference, they were $100 per day per employee for failure to report to the employees with my 1095. That is now changed to $250 per day per employee, and the annual max on that was $1.5 million. They have now raised that to $3 million, so they doubled the stakes on that. And then the failure to report to the IRS, again, if you're doing it electronically in March, that's if you, any day that you are after March 31st, you'll start being incurring a penalty of $250 per day until you get that out. So, and again, the max on that is from $1.5 million to $3 million.
So in February, if you don't do anything, you could have a $500 per day per employee fine stacking up there. Failure for the limited waiting periods, that's where if you hire somebody and you reasonably expect them to work over 30 hours per week, then you need to offer them coverage within 90 days of hire. So that's $100 per employee if you don't offer them coverage. Failure to provide affordable coverage. Now we talked a little bit about affordability and what number has to go in your 1095. Affordability is you can only charge the employee for single coverage for your lowest plan 9.5% of their salary. So if you have a plan or you have a district and you have two options, you have a low option and a high option, they're both minimum value coverage, and you have an employee that gets family coverage on your high option, you're not going to look at that at all. You're going to use the lowest plan and the single cost to that person. So it doesn't matter what they actually take, like your Cadillac tax goes off what they're actually taking. This is only what they're offered single. And the 9.5% is of their salary, and you get to choose between three options on what you want to use. You can use the federal poverty level, you can use their rate of pay, or you can use their W-2 Box 1. So you choose one of those three options, and you can't charge them more than 9.5% of their salary for that single lowest coverage. We work with a lot of districts, and any of your standard teachers, we don't see an issue in their contracts. The ones that come up are if you have a cafeteria worker or any of your lower paid people, or if you happen to have a substitute teacher who may be a coach, who may be a drama teacher, something like that, where they're not in a union contract, but they actually average more than 30 hours after you track them. So those are the people you want to look at what you're charging.
Now, failure to provide affordable coverage, pay the lesser of the $3,000 for each full-time employee receiving the premium credit. If you remember, we've talked about this in the past. This year, for 2015, we have transitional relief, which means that we have to offer to 70% of those employees that average 30 hours or more, plus the rest of my full-time employees. Most districts that we've reviewed the payroll on, the 70% threshold can be met. I will tell you that, however, this does potentially, if you choose not to offer, and you can choose not to offer, that one of those employees goes out to the exchange and they get a subsidy, you could be assessed that $3,000 penalty for that employee that you chose not to offer coverage for.
And that's an annual penalty. So you would pay the $3,000 divided by 12 times the month that they received the subsidy.
Right. And, you know, next year, the biggest challenge comes up that it's going to be 95% of those that average 30 hours or more that you have to offer coverage to. So this year, they allowed that transitional relief for you to understand how many is there that I have that hit that threshold, and then how many, how do I manage, how do I budget for those people coming on my plan the following year. And now we get into Cadillac Tax. This is one thing, and we kind of have, because a lot of you were on this last time we did this, we wanted to kind of go through the slide deck, make sure we got through it all, and then really address all the questions that you may have. But Cadillac Tax is something that we should all be planning for. There's been recent articles that have been, the CBO has come out and said that by 2018 they expect 25% of all groups to be subject to the Cadillac tax. And then they expect that number to grow each year after that. And what it basically says is if my total premium or my expenses, if I'm a self-funded plan, is up to $10,200 per individual or $27,500 for a family, any dollar over and above that will be a 40% excise. And as the law is written today, that excise tax is paid for by the district. What the Cadillac tax does include is any former employee, a surviving spouse, so all those will accumulate towards that. It does not include a separate dental and vision plan. benefits for which medical care is secondary, workers' comp, or accident or disability. But there are other coverages that it does include, and that would be if you offer a flexible spending account, if you offer an HSA, and it doesn't matter if it's the employee's money or the employer money going into the HSA, that would be added to the premium. And these numbers were set in 2014, and they were indexed to 2018. They actually gave us transitional relief for those 4 years to get prepared for this. So those rates are set in stone. It's a single coverage that exceeds $850 for a single or $22.91 for a family. Again, any dollar over and above that would be subject to a 40% excise tax.
And remember, like Mike said, it counts for flexible spending. So if you have employees who are putting their own money into, and this is for medical only, does not include daycare. So it's whatever the IRS considers medical. So their flexible spending account, they're putting their own $2,000 into there. That's going to be added to your premium. So to figure out what your Cadillac tax would be, you need to take the entire premium, what the portion you're paying and the portion that the employee is paying on the plan that they're actually in, and then add in if they put any money into flexible spending, add into if you have an HSA, what is going into that, whether they use it or not, whatever's allocated for them. If you have an HRA, that money counts. And if you have any pre-taxed voluntary plans that the IRS considers medical, so you need to add in if you have pre-taxed cancer, specified disease, or hospitalization. And then it is paid by month, like Mike's saying down here. Any amount over that $850 or $22.91 is taxed at 40%.
And one of the other things is the Cadillac tax is based on, like Kirsten had said, is based on a monthly basis. And we have talked to some smaller districts that and municipalities that actually have dumped in money into an HSA bank account in the very first month of the year. So as we cycle around towards 2018, if they don't redefine that piece of the law, if you're doing that today, you may want to contribute on a month-to-month basis to lower the exposure from a Cadillac tax perspective.
So everybody knows there's an election coming up, and that Cadillac tax has been one of the big things that the Republicans are talking about replacing. And the way that they're going to replace it, this is still in progress, but they're going to, the idea is to have the employee pay the tax instead of the employer. As it's written currently, the employer is going to write that check and pay the entire 40%.
Yeah, and basically what this means is that if you pay $20,000 for me as an employee, then 35% of that $20,000 is going to be, which is roughly around $6,000, will be imputed income on my taxes, so, or on my W-2. So now, as an individual, I'd show up and do my taxes. They'd see $6,000 of imputed income. If I'm at the 30% tax bracket, then that would be about $1,800 in additional federal taxes that I would pay, or they would reduce my refund from. So it is purely, I would say, party line in that the Republican bill comes down to the employee paying the bill, and the current legislation is that the employer is responsible to pay the tax.
And what we learned from this is somebody has to pay for everything that's been happening. So with the subsidies, with the changes in the way that we're doing health insurance in this nation, we need more money to pay for it. So one way or the other, somebody's going to have to pay for it. And we need to be talking to our unions and our employees about the differences and how this is going to work. Our services, what we do, and again, like we said, go to your payroll, go to your in-house, see if somebody's going to produce these, see if somebody can draft your ACA policies, what kind of support you have in-house, who's keeping up with the law, and where you're getting this information. We do have an electronic software system that tracks your employees, that goes through and will issue those 1095s and 1094s. So make sure that when you're asking who's going to do this for you, that they can do electronic transfer to the IRS for your 1094s and can produce your 1095s and make corrections. Yep. Forecasting your Cadillac tax is important at this point. You need to do that and be talking to your unions about it so that everyone is on the same page within your organization.
These are just really things that you've got to think through, and that's why we wanted to make sure we got to these. For those of you that attended the regional meetings after the June conference, we kind of handed out this same sheet saying, hey, these are things that you need to focus on. You need to find a vendor that can do it because the fines are substantial. And they did make a statement. The federal government has come out and said that everybody has to go through this process this year. They know that there's going to be bubbles. They know that there's going to be hiccups. They also know that the 1095s are not going to be perfect. But they want everybody to go through the process. And if you go through the process, they'll come back and give recommendations on what needs to be tweaked. But they won't be as harsh on penalties. So just keep that in mind as you go through it. If this gets ignored, those are the first ones that they're going to go out and assess the money. And the reason why they have to assess the money is we've got over 11 million people now in the exchange, and of those 11 million people, 86% of them are receiving subsidies. So there has to be a means to pay for that reduced coverage that they're paying for. So with that, I guess we can open up the lines and we can answer some direct questions.
Hope you have some written ones, Matt.
Oh, I've got plenty. All right, so we'll do this from, let's see, when they first came in. So we have a question from Laura. Do the written procedures need to be adopted or approved by the Board of Education?
The IRS has not made a statement on that. When we do a draft, we do it policy or procedures because we work with some districts who have policies that they don't have to get approved or procedures that they do, so they want to call it on one or the other. This has been a question posed to the IRS, and they haven't come out and said whether it has to be official. They want it in writing because they're going to come in, and when they do, and Mike and I, our association is National Association of Health Underwriters, so we attend these seminars on how they're going to audit and what's going to happen, and what they tell us is they're going to come in and they're going to say, what's your policy, read your policy on what you have or your procedure, doesn't matter, and how do you follow it? So the answer is right now, no, you don't have to have it approved by anybody special.
And the other answer piece to that would be it purely depends on your board. Some boards love to be involved in all that. Some boards look at this as a new HR policy or procedure and just document it and follow it.
Okay, next question is from another Laura. What proof do you need that the SBC was provided to current and new employees?
You need, there's not a certain proof, but you don't want the IRS to come in and say, did you give out your SBCs, kind of like your notice of exchanges? Do you give them out to all of your new hires? And if you just say yes, then they're going to turn around if you have no proof, and they're going to say, well, give me the list of 10 people who were just hired, and they may go up and ask them, and what will happen is you'll go up to a new hire, and they will, and they'll say, did you get this notice of exchange or this SBC? And they'll say, I don't know.
Best practice would be if you have an open enrollment where you invite all your employees to learn their new benefits, handing that out at that time, and then having a sign-in sheet where people can come in and that way you can prove that, hey, here's the packet, here's all the information that was shared at that point, and these are all the people that signed in.
Or a new hire checklist for your new hires and add it to that. So when they come in and they say, do you give out these notices, you say, yep, and here's the proof. You want just quick and easy, in and out.
All right, the next question is from Luann. How do you treat disability leaves in the look-back period?
You have to, on your tracking, you have to count every compensated hour. So if it's paid anything, then you have to count the hours. So if it's paid jury duty, if it's paid bereavement, paid vacation, paid hours paid. And that's why it's so important to also assign hours to your coaches, because it's paid hours and you can't count 1 hour for their whole soccer coaching. Because if you count 1 hour, then there's rules on where you have to count 1 hour as 8 hours or 8 hours as a full week. So just think compensated hours have to be counted.
Okay, next question is from Luann. What if you have an employee who was full-time that later chooses to go part-time? Does the district still have to contribute to the coverage to make it affordable if they are no longer full-time and entitled to benefits?
Well, that's a great question, and there's actually come out with some more legal opinions on this. And what they're saying is that that employee who was full-time receiving the employer's contribution strategy, if their hours got decreased, they still would be eligible based on your measurement period, your published measurement period, to get credited for those past hours in there. So they, in essence, would still be considered a full-time employee.
Until they were part-time and it ran out of their measurement period and
Right.
their stability period.
Now, if that employee were to terminate, then obviously you follow the same rules and you would offer them COBRA.
All right, next question is from Diana. We provide insurance to retired teachers over 65 as supplemental to Medicare. Do we still need to provide a 1095-C?
Yes. The 1095s for people over 65, and you're offering just a supplemental coverage, Medicare is going to provide them with it.
No.
Right. You will not have to provide one because Medicare is their primary coverage, and they're going to supply them with a 1095.
All right, another question from Luann. How do you handle mid-year hires in the measurement period? When can they enroll? Do they have to wait for open enrollment?
Well, I'll answer this two ways. One, if I come in the middle of the year and I am already a benefit eligible person, then whatever unit that I come into, meaning that you expect me to work more than 30 hours per week, then I would be offered coverage whenever my unit or my contract says that I should be offered coverage. For those that are part-time employees that you're tracking them, you're going to track them from their date of hire for your measurement period. So if you picked a 12-month measurement period from the date of hire, you're going to track them for the next 12 months and see, did they average the 30 hours per week?
Okay, next question is from Tom. Would you list the business official as contact person or the payroll clerk?
Contact person on your 1094s and 5s, I'm suspecting they're asking. We would put whoever is going to be responsible for the IRS. I would put the comptroller. That's what we're putting on ours, is the business official or the comptroller.
It sounds like somebody's trying to point the finger.
All right, next we have a question from Laura. If an employee opts out of the health insurance coverage, do we need to know if they have other coverage or not?
You know, best practice has always been that you wanted to find out what if they had other coverage and they wanted to opt out. Now the individual mandate comes along, and the individual mandate says that I, as a taxpayer living in this great country, I have to have health insurance. So as long as you as an employer get that waiver form signed, that's your obligation. And have that signed each and every year. I know some of the districts that we have talked to, they said, well, when the employee came on board, they opted out because they were covered under their spouse's plan. Each and every year I would get a new form signed for that employee.
Yeah, in reality, your employee could show you a membership card or tell you they have coverage somewhere else and then go home and cancel it the same day. And the IRS knows that. Your obligation, like Mike said, is to offer affordable minimum value coverage to your employees that work over 30 hours. So you just have to show that you offered it to them and they declined.
Okay. This is from Tom. When you list the lowest cost of single coverage, do you mean the employee's cost or the total cost the carrier charges for that plan?
On your 1095 is the lowest cost to the employee. So only the employee section on that, because that's what they're doing the 9.5% testing off of.
Okay, this is from Kathy. We have a fully insured health insurance plan and a self-insured drug plan. Is the drug plan part of the minimum essential coverage, the minimum cost, and how do we report each? Is it required for both?
Yes, minimum essential prescription is a minimal essential coverage, and then you'd have to have a premium equivalent assigned to a single coverage of that prescription plan. And then you would report based on the contributions that the employees pay for both pieces.
Okay, we have another question from Luann. Just to clarify, if you are self-insured under 50 FTE, you file 1095B. Can you use 1095C if you want?
If you're under 50, you're only required to do the 1095B.
I'm not sure if it's an option. You know what? We're going to check on that.
We'll take that back and respond.
Okay. Question from Carol. We are not self-funded. Do we issue 1095s to our retirees or just those under age 65?
You're not self-funded, so you're fully funded. So you're going to retire. You're going to issue only to your employees. So you're not going to 1095 anyone who's a retiree. Only your actual employees between the months of January and December, calendar year 15 for this year.
And remember, the carrier is going to be issuing the 1095 data to a home email. The other piece that I'll say is you will also have to report on all the opt-outs on the 1095 will be your responsibility as an employer. So it'd be your active employees, your opt-outs.
On your active only.
On your active only.
Okay, our next question is from Luann. Is it possible to post the summary of benefits on our webpage for employees to view and be considered as providing it to the employees?
You can, as long as you follow the IRS electronic guideline rule. So you have to make sure that everyone has access to that website. You have to give them a notification that it's posted on the website. You have to have it available if they ask it for you in print. There's a bunch of IRS electronic guidelines that you would have to, they're DOL guidelines you would have to follow, and then you could do that if you pass all of those.
And what we've seen is we've had other districts identify the class of their full-time, like their teachers that know they have regular communications via internet and email, that yes, for those people you would post out there and you'd send an email saying that it is posted out on your intranet. For those others that you cannot determine whether they're in and out of the email on a daily basis, our best practice would be to mail it to their house. or do it through an open enrollment meeting and have a sign-in at the open enrollment meeting.
Okay. Next question is from Carol. How do we provide the SBC to each employee?
You could either, like, I think we covered that one. Again, I think we just covered that one. You can do it through an open enrollment meeting. You can do it in an annual booklet that you give out about your benefits at benefit meetings. Some people will do it hooked to their payroll. Again, you can post it electronically as long as you follow the DOL rules on electronic delivery.
Okay.
Yeah, this is one you want. Yep.
Go ahead.
This is one that you want to get right because it is a $1,000 a day penalty. So, okay, go ahead, Matt. Sorry about that.
Okay, that's all right. What is the SBC? Summary benefits of coverage. Is this from NYSHIP, a summary of coverage offered through NYSHIP? That's a question. Sorry.
Yeah, your SBC is that it was an 8-page document that had to be in font 12. When it first came out, it had to be blue. It can be black and white. NYSHIP does provide it for you, and they send a postcard home saying that it is there posted and how to get to it. You want to make sure that you have them ready for anyone who wants one, and make sure that you also just send out a notice saying, yes, your report's there. But it's the government's way of making a uniform benefit coverage notice, so everyone's following the same format. Whether it really fits your plan or not is up for discussion, but it's made for if you come home with one and your spouse comes home with one, you can put them side by side and they're in the same format and look the same, and then you can make the best decision about what coverage you can have. And there's a little terms and glossary. There's the last page that will explain some terms. It's government regulated form.
Thanks for being so clear with that.
Government at its best.
Question from Tom here. Does the Cadillac include healthcare 105H and employee section 125 contributions?
Yes.
Yes, it does.
Good, easy answer. Next one's from Sheila. Would money put into a union welfare fund fall under the Cadillac Tax similar to FSAs and HSAs?
If it's a Section 105, so you need to go back and ask them, do they put that money under, it's IRS Section 105. If that's a yes, then your answer is a yes. If that's a no, then that would be a no. It's the key. The key is how they fund it, how they record it to the IRS.
Right. At the end of the day, the Cadillac tax, Matt, has come down to be a threshold of pre-tax dollar, meaning that either the employer is taking a business write-off on the portion that they pay, and the employee is taking a pre-tax contribution off what they pay. The federal government has just kind of drawn a line in the sand and said, hey, anything over $10,200 or $27,500, we want 40 cents on the dollar. Unfortunately, I mean, they made us all believe that it was related really to plan design, but it comes down to more and more of a tax dollar.
All right. Lisa would like to know, do you have to include voluntary AFLAC plans that employees may purchase for cancer coverage or disability coverage?
Yes, as the laws, do you have, it does if it comes out pre-tax. It does, you do not have to count it if you switch the funding and make it an after-tax contribution.
Not disability coverage, so
Right.
it's anything the IRS considers medical, which would be cancer, hospitalization, or specified disease.
Right.
Those would have to be done. If they're pre-taxed, they would count. If they're after-tax, they don't count. Disability would never count because the IRS doesn't consider that medical coverage. But don't think you can then after-tax your premiums for your medical, because they've already said that medical premiums pre-tax or after tax, are counted.
All right. This is a long one from Tom. As the district will pay the Cadillac Tax 40% above threshold, is there anything that prohibits an employer from then charging an employee for a shared portion of the tax payroll deduction or other negotiated contract structure?
As the law is written, and I think, you know, they're going to come out with further and further clarification as we get, but as the law is written, it is supposed to be the employer's responsibility. The next obstacle there is if you try to charge it back, then chances are you're going to make your plan unaffordable, which would then subject you to another penalty. So when you think about it, if, you know, all of a sudden I get to the end of the year and I do hit the Cadillac tax threshold, and then I try to change my contribution strategy to charge them back, then I could be, you know, obviously subjecting myself to that $3,000 penalty per employee for unaffordability. So it's a double-edged sword, the way the law is written today.
Okay. Question from Harvey. I have heard one benefits administration firm state that the way they interpret coaches' time as de minimis and would fall under the volunteer role that is not subject to the 30-hour rules. Have you heard of this before?
Everything that we have read and seen is you have to document, and every legal opinion we've seen, if you pay them and they're not volunteers, then you have to document the hours that they were working.
But they don't fall under minimum wage requirements.
Yeah, and the one exception on the stipend employees is you don't have to worry about the minimum wage, because that's always been the biggest question. Was when I calculate the actual hours that a coach is, they may only get 50 cents an hour. But the reality is what they're looking to do is count the hours that are worked and see did they average the 30 hours per week, and therefore require an employer to offer medical coverage.
Okay, question from Luann. Under the Republican replacement bill, is it proposed to eliminate the reporting requirements, or is that likely to stay?
You know, I won't say it's funny, but you hear a lot of discussion today about it. I don't know how it can go away. When you think about the employer reporting that exists, it not only accounts for minimum value, it accounts for affordability of coverage, but it truly is a self-admission tool to the federal government. So if I make coverage unaffordable to my employer, it's going to show up, or to my employee, it's going to show up on my 1095. So it's an automatic trigger to do the audits for them to come out and assess penalties. It's really a tracking mechanism as well to the exchange, so that, you know, if one of your employees who opts out of coverage and then goes and tries to get to the exchange, the mere fact that you're going to generate a 1095 saying that you offered them coverage will shut down them being able to get a subsidy through the exchange. So this reporting really ties into a bunch of the pieces of the law, which at least through 2017, I don't see this going away. After that, I wish I had a crystal ball. My goal here, though, and Kirsten's, is to make sure that none of the groups that hear our presentations get assessed those penalties until the law changes again.
All right. Linda would like to know if there are any example policies that everyone can view.
Yeah, we could email you a policy map.
Yep, and then once I have that, Linda, I will post that on School Business Connect for you. Next question is from Patricia. When do SBCs have to be given to employees?
At time of offer of coverage and annually at renewal.
Okay. Janet would like to know, do you have to provide a 1095 to the dependents of a retiree who is under 65?
Dependents of a retiree under 65, yes.
If you're self-funded.
If you're self-funded. If not, the carrier, if you're fully insured, the carrier is going to do that piece.
All right. Karen would like to know, we have retirees under 65, but their spouse is over 65. Do we report on only the retiree and not the spouse?
Yes, if they're over 65.
Yep.
Okay. Luann would like to clarify. Just to clarify, the full-time employee that changes to part-time, the district would still have to contribute the same percentage until the stability period ends. Then after the stability period ends, we can remove them from coverage entirely.
Well, you would have to be measuring them if they're still part-time. Remember, you measure every employee if they're not offered benefits. So that person turns to a part-time employee, and when they turn part-time, you're going to be measuring them based on your standard measurement period. And if they continue to be an employee, you're going to continue to measure them on your standard measurement period. So you could technically have employees who 1 year, you're always measuring the year before for the coverage after the next year. So you could measure them, and 1 year they could average the 30 hours, and you have to offer them minimum value essential coverage. Then the next year they don't measure while they're on your plan and their stability, and then the next year you would offer them COBRA, and they could drop, and then you'd still measure them. So each and every year you're going to measure people.
All right, we have another question from Janet. Who pays the tax of AFLAC if the district does not pay anything towards the plan?
The district.
The district. It's just like a flexible spending account. It's just like well, it'd be just like a flexible spending account. The way the law is written, because it comes out pre-tax through your payroll system and from their pay, even though it's their money, they're including it in the Cadillac tax calculation. Simple fix to there would be to have a discussion with your unions today, and I mean, you're looking at $3 or $4 a week that comes out of their paychecks for that on a pre-tax dollar basis. Just flip that to an after-tax basis, and then there would be no exposure to the district.
All right, we are past 1 o'clock currently. We still have a bunch of questions. So what we'll do is I will send Mike and Kirsten the rest of your questions, anyone who's typed one in and hasn't received an answer yet. And one of the other attendees on the call wanted to know if I could put a summary of all the questions and answers up. I will certainly do that. It'll go up on School Business Connect, which can be found right on our main site, nasbo.org. Mike and Kirsten, thank you so much for a second webinar on the ACA and for answering all the questions our members have had.
Thanks,
Great,
Matt.
thanks, Matt, and thanks everybody for attending.
We appreciate it. Thank you.